Question 1. A 1-year-old boy has had multiple episodes of otitis media and pneumonia. Physical examination reveals eczema and petechiae. Lab studies show platelet count with small-sized platelets, IgE and IgA, IgG and IgM. Which of the following best describes the underlying defect? A. Defective lysosomal trafficking. B. Deficiency of NADPH oxidase. C. Defective cytoskeletal organization in leukocytes and platelets. D. Mutation in adenosine deaminase. E. Deficiency of thymic development. Correct answer, C. Defective cytoskeletal organization in leukocytes and platelets. Explanation. Wiskott Aldrich syndrome is due to a mutation in the WAS gene impairing actin cytoskeleton reorganization, affecting immune synapse formation and platelet morphology. Why not the others? A. Chediak-Higashi syndrome involves lysosomal trafficking. B. Chronic granulomatous disease. D. C. Due to ADA deficiency. E. DeGeorge syndrome leads to thymic aplasia. Question 2. A boy with recurrent pyogenic infections, eczema, and bleeding tendency is diagnosed with Wiskott Aldrich syndrome. Which of the following immunoglobulin profiles is most likely in this patient? A. IgA, IgM, B. IgM, IgE, IgA, C. IgG, IgA, normal IgG and IgA, IgE, E. All immunoglobulin levels elevated, B. IgM, IgE, IgA. Explanation. A typical immunoglobulin pattern in Wiskott Aldrich is IgM and IgA, IgE. Why not the others? A. Opposite pattern seen in hyper-IgM syndrome. C. IgG usually low or normal. D. IgE is increased in WS. E. Not all immunoglobulins are elevated. Question 3. Which of the following clinical findings would help most in distinguishing Wiskott Aldrich syndrome from other primary immunodeficiencies? A. Severe eczema and anaphylaxis to transfusions. B. Small platelets and thrombocytopenia. C. Increased AFP and ataxia. Delayed separation of the umbilical cord. E. Absence of germinal centers on lymph node biopsy. Correct answer, B. Small platelets and thrombocytopenia. Explanation. A hallmark of Wiskott Aldrich syndrome is microthrombocytopenia, low platelet count with abnormally small platelets. Why not the others? A. Suggestive of IgA deficiency. C. Classic for ataxia-telangiectasia. D. Seen in leukocyte adhesion deficiency, LAD. E. Seen in hyper-IgM syndrome. Would you like these formatted